Most seniors pass away within a few years after turning 70. Doctors say these issues are the reason. Aging is a natural process, but as the body crosses the threshold of 70 years, many seniors find themselves facing unique health challenges. While advancements in medicine and healthcare have extended life expectancy, statistics show that a significant number of seniors pass away within a few years of their 70th birthday. Why is this the case? Doctors have identified several key issues that contribute to this trend. Understanding these factors is critical for improving longevity and quality of life in the later years. 1. Chronic diseases take center stage. One of the most significant contributors to mortality after 70 is the prevalence of chronic diseases. Conditions like heart disease, diabetes, and chronic obstructive pulmonary disease, COPD, become more common with age. The aging process weakens the body's ability to repair itself, making seniors more vulnerable to these ailments. Cardiovascular diseases, including heart attacks and strokes, are the leading causes of death among seniors. A lifetime of poor dietary choices, lack of exercise, and genetic predispositions can culminate in clogged arteries and other heart-related issues. Diabetes is another silent killer. It doesn't just affect blood sugar levels, it impacts the heart, kidneys, eyes, and nerves. For seniors, managing diabetes becomes more complicated due to other coexisting health conditions. Similarly, COPD, often linked to a history of smoking, progressively impairs lung function, making daily activities increasingly difficult and reducing life expectancy. 2. Weakened immune systems. The immune system naturally declines with age, a phenomenon known as immunosenescence. By the time an individual reaches 70, their immune defenses are less effective at warding off infections and illnesses. Seniors are particularly vulnerable to pneumonia and influenza, both of which can be fatal. The reduced production of immune cells and slower response to pathogens means infections can escalate quickly, leading to complications like sepsis or respiratory failure. Vaccination can provide some protection, but it's not foolproof. Doctors emphasize the importance of early detection and proactive healthcare to mitigate the risks associated with a weakened immune system. 3. Frailty syndrome. Frailty is a condition characterized by reduced strength, endurance, and physiological function. It affects many seniors and significantly increases the risk of falls, hospitalization, and death. A frail individual may find it challenging to recover from even minor illnesses or injuries. The condition often stems from a combination of muscle loss, sarcopenia, poor nutrition, and chronic diseases. Frailty also correlates with a sedentary lifestyle, which accelerates the decline in physical and cognitive function. Doctors recommend resistance training, a balanced diet rich in protein, and regular physical activity to combat frailty. While these measures cannot completely reverse the condition, they can slow its progression and improve overall quality of life. 4. Cognitive decline and neurological disorders. Alzheimer's disease, dementia, and other neurological conditions are common among seniors and can significantly impact their lifespan. These conditions don't just affect memory and thinking, they can also impair physical abilities and decision-making skills. Neurological disorders often lead to complications such as difficulty swallowing, which increases the risk of aspiration pneumonia. Behavioral changes can also lead to neglect of basic self-care, further compromising health. Early diagnosis and interventions, such as cognitive exercises, medications, and lifestyle changes, can help manage symptoms and delay progression. However, these disorders remain a major challenge for aging populations. 5. Social isolation and loneliness. Mental health is closely tied to physical health, and social isolation can have devastating effects on seniors. Many older adults experience loneliness due to the loss of spouses, friends, or family members, or because of mobility issues that limit their ability to engage in social activities. Loneliness has been linked to increased risks of depression, anxiety, and even cardiovascular disease. It also weakens the immune system, making seniors more susceptible to infections. Chronic loneliness can lead to a vicious cycle of declining mental and physical health, ultimately shortening life expectancy. Community programs, family support, and technology can help combat social isolation. Regular interaction with loved ones and participation in group activities are essential for maintaining mental and emotional well-being. 6. Poor nutrition and malnutrition. As people age, their nutritional needs change, but meeting those needs can become challenging. Many seniors experience a loss of appetite, dental issues, or difficulty cooking, which can lead to malnutrition. Malnutrition weakens the body, making it more susceptible to infections, muscle loss, and other health problems. Deficiencies in essential vitamins and minerals, such as vitamin D, calcium, and iron, are particularly common among seniors and can exacerbate conditions like osteoporosis and anemia. Doctors recommend regular dietary assessments and the inclusion of nutrient-dense foods in the diet. For those with difficulty eating, nutritional supplements can provide the necessary vitamins and minerals to maintain health. 7. Polypharmacy and medication issues. Many seniors take multiple medications to manage their various health conditions, a practice known as polypharmacy. While medications are essential for treating illnesses, they can also cause side effects, interactions, and complications. Adverse drug reactions are a leading cause of hospitalizations among seniors. Additionally, medications that cause drowsiness or dizziness can increase the risk of falls, which are a major cause of injury and death in older adults. Doctors emphasize the importance of regular medication reviews to ensure that seniors are not taking unnecessary or harmful combinations of drugs. Simplifying medication regimens and using tools like pill organizers can also help. 8. Falls and injuries. Falls are one of the most common and dangerous issues faced by seniors. After the age of 70, a fall can result in fractures, head injuries, or other complications that significantly reduce life expectancy. Many falls are caused by a combination of factors, including poor vision, muscle weakness, balance problems, and medication side effects. Homes that are not senior-friendly, with hazards like slippery floors or loose rugs, further increase the risk. Preventing falls requires a multifaceted approach, including physical therapy, home modifications, and the use of assistive devices like canes or walkers. Regular vision and hearing checks are also crucial for maintaining balance and awareness. 9. Lack of preventive healthcare. Preventive healthcare becomes even more critical as people age, yet many seniors neglect regular checkups and screenings. This can lead to late diagnoses of treatable conditions, reducing the chances of successful intervention. Routine screenings for conditions like cancer, osteoporosis, and cardiovascular disease can catch problems early and improve outcomes. Vaccinations, such as those for shingles and pneumonia, are also essential for preventing serious illnesses. Doctors encourage seniors to maintain a proactive approach to their health, including regular visits to healthcare providers and adherence to recommended screenings and vaccinations. 10. Mental health disorders. Depression and anxiety are often overlooked in seniors but can have profound effects on physical health. Mental health issues can lead to neglect of self-care, poor nutrition, and reduced physical activity, all of which contribute to a decline in overall health. Addressing mental health requires a holistic approach that includes therapy, medication, and support from family and friends. Engaging in activities that bring joy and purpose can also improve mental well-being and extend life expectancy. 11. Respiratory issues. Respiratory health becomes a critical concern for seniors, especially after 70. Chronic conditions like asthma, chronic obstructive pulmonary disease, COPD, and even the residual effects of past respiratory infections can compromise lung function. As the lungs age, they lose elasticity, making it harder for seniors to breathe deeply and efficiently. This can result in lower oxygen levels, fatigue, and a higher risk of infections like pneumonia, which is particularly dangerous for older adults. Environmental factors, such as air pollution and smoking history, further exacerbate these issues. Doctors recommend pulmonary rehabilitation, regular exercise to strengthen the lungs, and vaccinations to protect against respiratory infections. Avoiding pollutants and ensuring proper indoor air quality are also essential for respiratory health. 12. Vision and hearing loss. Declining vision and hearing are common issues that can have far-reaching consequences for seniors. Cataracts, macular degeneration, and glaucoma often impair vision, while age-related hearing loss, presbycusis, affects the ability to communicate effectively. These sensory losses can lead to accidents, social isolation, and even cognitive decline, as reduced sensory input affects brain function. Seniors with impaired vision or hearing are also at higher risk of depression and anxiety. Regular screenings, corrective aids like glasses or hearing aids, and treatments such as cataract surgery can significantly improve quality of life. Additionally, creating an environment with good lighting and minimizing background noise can help seniors navigate their surroundings safely. 13. Sleep disorders. Sleep quality tends to decline with age, and many seniors experience issues such as insomnia, sleep apnea, or restless leg syndrome. Poor sleep can lead to a host of problems, including fatigue, weakened immunity, and an increased risk of chronic diseases. Sleep apnea, in particular, is a serious condition where breathing repeatedly stops and starts during sleep. It is associated with cardiovascular problems, cognitive decline, and even sudden death. Doctors recommend establishing a consistent sleep routine, reducing caffeine intake, and seeking medical advice for persistent sleep issues. Sleep studies and treatments like CPAP, continuous positive airway pressure, therapy can help manage conditions like sleep apnea. 14. Oral health decline. Oral health is often overlooked, but it plays a significant role in overall well-being. Seniors are more prone to gum disease, tooth loss, and dry mouth, which can affect their ability to eat and speak properly. Poor oral health is also linked to systemic conditions like heart disease and diabetes. Many seniors face challenges in maintaining oral hygiene due to arthritis, cognitive decline, or financial barriers to dental care. These issues can lead to infections and malnutrition, further compromising health. Regular dental checkups, proper oral hygiene practices, and a diet low in sugary foods can help maintain oral health. Dentures or implants can also improve functionality and quality of life for those with tooth loss. 15. Kidney function decline. Kidney function naturally declines with age, but for some seniors, this progression leads to chronic kidney disease, CKD. The kidneys are responsible for filtering waste and maintaining electrolyte balance, and their reduced efficiency can result in toxins building up in the body. CKD often develops silently, with symptoms appearing only in advanced stages. This makes regular screening for kidney function essential, especially for those with risk factors like diabetes or high blood pressure. Untreated, CKD can progress to kidney failure, requiring dialysis or transplantation. Doctors emphasize the importance of managing underlying conditions, staying hydrated, and avoiding medications that may harm the kidneys, such as nonsteroidal anti-inflammatory drugs, NSAIDs. 16. Mobility issues and arthritis. Mobility problems are a common complaint among seniors, often due to arthritis, osteoporosis, or joint injuries. Osteoarthritis, the wear-and-tear form of arthritis, affects millions of seniors, causing pain, stiffness, and reduced mobility. Mobility issues can lead to a sedentary lifestyle, which in turn increases the risk of chronic diseases, weight gain, and mental health problems. Additionally, reduced mobility heightens the risk of falls and fractures. Physical therapy, low-impact exercises like swimming or Tai Chi, and appropriate pain management strategies can help maintain mobility and independence. Assistive devices, such as walkers or canes, can also provide stability and confidence. 17. Cardiac arrhythmias and heart failure. Heart-related issues extend beyond heart attacks and strokes. Many seniors develop arrhythmias, such as atrial fibrillation, which can increase the risk of blood clots, strokes, and heart failure. Heart failure, a condition where the heart is unable to pump blood effectively, is another common issue among seniors. It often results from long-standing hypertension, coronary artery disease, or previous heart attacks. Symptoms like shortness of breath, fatigue, and swelling in the legs can significantly impact daily life. Early detection through regular checkups and managing risk factors like high blood pressure and cholesterol are essential. Lifestyle changes, medications, and in some cases, surgical interventions can help manage these conditions. Conclusion: embracing healthy aging for a longer life. Aging is a journey filled with unique challenges, especially as one crosses the threshold of 70. The high mortality rate among seniors in this age group can largely be attributed to the 17 critical issues discussed, ranging from chronic diseases to social isolation. While these challenges may seem daunting, they are not insurmountable. With awareness, proactive measures, and a commitment to health, seniors can improve their longevity and quality of life. The first step is acknowledging the physical realities of aging. Chronic diseases like heart disease, diabetes, and kidney failure are major contributors to mortality in seniors, but they can often be managed effectively with early diagnosis and proper treatment. Regular checkups, a healthy diet, and staying physically active are foundational to maintaining physical health. Additionally, seniors should not hesitate to seek medical advice when they notice unusual symptoms. Mental and emotional well-being are equally important. Loneliness, depression, and anxiety can be as detrimental as physical ailments, leading to a vicious cycle of declining health. Strong social connections, engaging in hobbies, and seeking professional help when needed can mitigate the mental health challenges associated with aging. Seniors should prioritize staying socially active, whether through community programs, family interactions, or technology that bridges distances. Preventive healthcare is another vital component of healthy aging. Many of the conditions that shorten life expectancy, such as cancer and cardiovascular disease, can be detected and treated early through regular screenings. Vaccinations, dietary adjustments, and fitness regimens tailored to senior needs can further reduce risks. Preventive care is not just about extending life but ensuring those extra years are lived in good health and with vitality. Environmental factors play a significant role in senior health. Homes should be adapted to reduce fall risks, with proper lighting, handrails, and non-slip surfaces. At the same time, improving access to assistive devices like hearing aids and glasses can dramatically enhance quality of life. Small adjustments can make a significant difference in maintaining independence and safety. Perhaps most importantly, seniors and their families must approach aging with a positive mindset. While it's natural to focus on the physical and mental decline associated with growing older, it's equally essential to celebrate life's milestones and cultivate gratitude. A positive outlook not only enhances emotional well-being but also contributes to better physical health by reducing stress and boosting the immune system. In conclusion, aging doesn't have to be synonymous with decline. By addressing the 17 critical issues discussed, seniors can embrace their later years with confidence, dignity, and joy. It is not just about adding years to life but adding life to years. With the right support, lifestyle choices, and proactive healthcare, seniors can enjoy a fulfilling and meaningful journey, even well beyond their 70s.